Well, hi everyone, this is Dr. Schroeder with this week's video introduction to week number 7 in this course in the Foundations of Patient and Staff Education. And in week number 6, very straightforward discussion this week. We really only had discussion and not too much in the way of written work, except for the work that you've been doing already for your week 7 assignment, that I'll talk about here in a little bit. But the focus of this week was to talk about the idea of you being a staff developer and needing to identify what the learning needs and what the teaching needs would be with the staff in your hospital. And so the idea here is to discuss some of the factors that you would use to identify good information for what the learning needs of staff are. First of all, I kind of preface this by saying that this is really an important role of the staff developer and a staff educator. Besides teaching this information, the developer also has to identify what are the teaching needs or what are the learning needs of the staff, not just the nursing staff, but sometimes it's the medical staff, sometimes the CNA staff, and any other ancillary staff as well. They all need to be assessed. And I think for the most part, the class hit on most of the important ways that this is done. Needs assessment is usually a part of that. I found needs assessments and questionnaires given to staff about what their ideas are to be very good way, but it's not the only way. Another good source for information is to go to your quality management department or your risk manager or your performance improvement. Look at what your performance improvement activities are for your organization, or identify those areas where there are currently opportunities for improvement. Say, for example, if you've seen a spike in hospital-acquired infections, or a spike in C. diff transmission, or a spike in medication errors, any of these sort of things. These would all be prime areas that you would want to identify as being where you would want to, or areas that you would want to focus on for continuing education. And it kind of goes back to our discussion from back in week number 2. We talked about who was best person to identify what somebody's learning needs are. Is it an individual nurse, or is it a staff developer working within the hospital that can identify what those needs are? Really, I think the real answer to that in the real world is both are important. I personally am an advocate of having nurses responsible for their own continuing education. However, at the same time, I also have experienced personally that you can really make changes by having a staff developer that works with a quality manager to really identify what those learning needs are. So everybody was sort of sharing their opinion as to whether nurses should or shouldn't. Most of you felt that nurses should be responsible for their own education. I tend to agree with that. Those of you that had said that, I agree with you and kind of have agreed with you all along. But there is the other side to this where that is only part of the equation. Nurses usually aren't their own or the best person to really assess what their individual learning needs are. It has to be done on the unit as well. So once again, a very nice discussion this week. In week number 7, we switch focus a little bit, and you've got 2 things coming up. First, you have a discussion question, and we're going to be introducing something that I know that most of you have at least heard about or know about, because it's become rather ubiquitous and all over nursing education in particular, is this concept of QSIN. QSIN stands for Quality, Safety, Education in Nursing. And the idea here is that in nursing we've identified key factors or key areas that are really important because, well, safety is important, and patient safety, individual staff safety, these are all really important considerations. So QSIN is a way to focus that and to focus that discussion and identify what some of those areas are. And so you're going to be completing a discussion question where you're going to do a literature search cross-referencing quality and safety and related to a topic to nursing and this QSIN, this quality, safety, and education, and basically talk a little bit about the article that you find. There's a lot of information out there a lot of evidence-based practice has been done related to QSIN. So you shouldn't have too much trouble finding some articles. And so this is kind of a fun discussion question because it'll give you a chance to share with each other articles and share with each other information that is out in the nursing literature. That will help you to maybe identify some new areas or some new information for your current roles or for your growing roles as nursing educators. And this week also your final written assignment for the class is due. This is your QSIN staff education simulation. I discussed it a little bit last week when I introduced it, and we'll just follow up this week by saying to review the rubric as always. Make sure that you cover all the areas on the rubric. All the areas that are on the rubric should be on your paper, but essentially what you're going to be doing is creating a simulation. And a simulation does not necessarily have to be a human simulator simulation. This can be it could be a case study. It could be some sort of a self-study module that a nurse may complete or a staff member may complete, but it's going to address one of the QSIN competencies and include, you'll read about it this week, we call them KSAs, your knowledge, skills, and attitudes. These are important because learning something isn't just learning it cognitively. It's not just didactically memorizing information. It's also learning the knowledge that you need, but also the skills, the hands-on skills or the specific assessment skills that are required, and also the attitude. What is your attitude, or what is your students' attitude going to be? How are you going to measure their attitude and their aptitude towards that particular learning module? So as you have any questions, as always, feel free to post those. I'll be more than happy to clarify. And those will be due on Sunday of this week. And then we've only got one more week after this week, so we're kind of really getting down to where we're winding down. So I hope everybody has a wonderful week. I'm looking forward to a great week of discussion, and I look forward to seeing you in discussion forums.